without a good head support. So this area is not supported, and it's most of the problems that I saw as a physiotherapist is the transition between the cervical spine. So the cervical spine ends about here, like the C7 of the cervical spine, until the thoracic spine, the upper back. It's there. That's where the most problems are in physiotherapy. That's where I saw it. Of course, in a dental chair, you have to make total extension and rotation to be able to see the upper jaw. So what did I do? I just invented a shape that corrects the spine in the most relaxed position. So I took x-rays, or I didn't take x-rays, I used x-rays, and I measured the perfect shape in a relaxed position, in a lying down position. So if you put the headrest under, go back. Now the spine is supported all the way to the upper back, and the cervical spine is in the most relaxed position. If you're going to use memory foam, because you're going to get that question, it must be memory foam because it's much more comfortable. If you use memory foam, because of the weight of the spine and the head, you will sink into the pillow, down into the memory foam, and then you will lose this position. This position is the most important thing because that's the most relaxed position of the patient. So the pillow has to be like a bit soft because it has to be comfortable, but it also has to be a bit stiff. It has to be supportive. So we had to look to the perfect combination of the foam that's inside, because the foam inside has a kind of stiffness and the artificial leather has a kind of stiffness. So that combination is now perfect for like and relaxation and is supportive of the cervical spine. If you put the pillow too much like here, that's what we sometimes see. Well, you see the head will tilt like in flexion, so you'll never be able to see the upper jaw. So the most important thing is let the patient, or do it yourself as a dentist, put it all the way to the upper back. Then the head can go backwards, and then you can make like the rotations and the extension of the head. Sorry for touching your head, but I had to show. So that's in a way the story of the Happynecks. So the questions are going to be: is the head not going to be higher with the Happynecks? Then I'm going to say no, because if I take it away, you will adjust the headrest that it's going to be up. So the height is going to be the same. You're going to have the question of the memory foam. Well, I'll just explain. You're going to have the question of the extension, and the extension finds place in like the upper 3 vertebrae of the cervical spine. So you will always be able to make this extension. You see it when you see older women walking like this with like a rollator. They can always make this extension to look forward. So it's always possible to make the extension to look in the upper jaw. So you can always use that like as an example. When we talk about the lumbar, if you look at back supports like in chairs or in car seats or chairs like for an office, you always see like you have half a circle. If you look at the x-rays again, so you'll use signs to make the products, and then you will see it's like an oval form. So this oval form fits exactly the lumbar spine, or at least like 95% of the curves of the lumbar spine. Some people are going to say you have to make it bigger because otherwise it will fall down between the hole here. What happens with some chairs? If we make it bigger, then it doesn't fit the lumbar spine anymore. So we're not going to make it bigger. We're going to keep it like this. If it falls down, it doesn't match the chair, then it doesn't match the chair. We're not going to change the product because of the chair. We match the product because of the anatomy of the patient. We made it too wide because it's too wide. Especially we made it 40 centimeters because now you can also use it under the knees. If you use it under the knee, you will get like about 30 degrees flexion under the knee, and it's the most relaxed position of the knee again. So you can use it like females who are pregnant, or people like after total knee surgery or something like that. Because it's oval, you won't get any compression in the popliteal here of the nerves and the veins that are going there. So with longer treatment, you won't have any problems like people getting tintling in their legs or something like that. So in a way, simple product. Also good to know if people don't like to have it on their back. Some people don't like it. They think it's overcompensating a bit. If you put it under your knee, you will get a bit more hip flexion. Because if you get a bit more hip flexion, the pelvic will tilt a bit backwards, and when the pelvic tilts a bit backwards, you will also get a relaxation in the lower back. So 50% likes it in the behind the back, and 50% likes it for the lower back under the knee. So if it doesn't match the chair, you can always say, okay, try it under the knees.
Would it be an idea to have both? Two?
And
One
here
there
again,
and one? No.
I think it's too much.
Yeah.
And then you have like 3 items on the chair. I don't think it's necessary. Either they like it there or they like it here. Yeah. It's like it's a medical artificial leather. Artificial leather has like well, it doesn't like alcohol, of course, because it will get stiff at the end. So what we say, clean it with the same stuff or liquid you clean your chair with. It's now for 2.5 years on the market. It has been cleaned 2.5 years with alcohol, no problem yet. But of course, don't advise you have to use alcohol to clean it because.
We have used it as an argument that you can.
You can clean it with alcohol, of course. But we always say you can use it with alcohol. But remember, alcohol and artificial leather are no friends of each other. So just keep it as like a small escape. But I mean, they also clean the chair sometimes with stuff that's not
non-alcohol.
Yeah, of course that's better.
Yeah.
Well, small detail, zipper inside out, because then it cannot damage your chair. I don't know if you recognized it. The zipper's inside out, no, but it's a small detail. And also one more detail I have. Can I put it on? There's a strap on. There has to be a strap on because otherwise it falls down if you want to flush. We could use like French zippers to tighten it. You don't want to tighten it too tight because if you put it behind the back and the patient will go backwards, you have to correct it once, like all the way to the upper back. Of course, in elastic there's rubber, and if you pull on rubber like many times, it will get more loose. There's nothing to do about it. I mean, it will look less good than it is now, but that's okay. The only function of the elastic is that it doesn't fall on the floor. That's the only function.
Okay.
May get a bit sloppy. It is what it is. There's no other material that stretches and that doesn't get sloppy. Yeah?
Good.
Some questions?
So the main point,
The main point.
if you can say it again.
The main point. If you want to lie down one more time. The main point is supporting of the cervical spine all the way to the transition of the cervical thoracic spine with full range of motion of the head. So the patient is much more comfortable. For the dentist, it's much more easy to work because the patient is more comfortable. So he's already like in an advantage, and he has full range of motion of the head. It's 20 centimeters wide, so if the patient will turn its head, it won't have the idea that it will fall off the headrest. So it will stay relaxed, also in the extension rotation positions. So main argument, supportive all the way.
And not foam.
No memory foam.
No memory foam.
Because you want to maintain the position of the cervical spine in the most relaxed position. And with memory foam, you cannot, simply. Yes?
Perfect.
Okay.
Good.
Ja, vi lägger